this is Stephanie. Somebody was calling me? Yes. Yep, I'm here.
We good, Alex? What's going on?
Yep, I got it.
Hello? All right, cool, thank you. Jesus.
All righty. Oh, you're welcome.
Everybody's losing it. Juliana?
She's so good.
Good. She's not in a danger,
She has chronic lung disease from premature birth.
Well,
So I was
so
trying to
she-
find out and I can't figure out.
Well, so she needs to be like.
Yeah, so that's why I'm like, I'm willing to press on this.
What's up, man?
All right, so you're good, I can leave then.
Are you?
I mean.
No,
Is this
they
you?
told me to be, you know, I
You
get.
could just cover them from FaceTime and ask questions on FaceTime.
Anyways.
I don't know what you're talking
There's no
about.
reason.
I
we
was
just-
told to bring you a backpack.
Okay, yeah. Then,
20 minutes later, well, they may not be here, so you need to be prepared and set up.
well,
Okay,
All right,
so
go
that's
ahead,
not
go.
what you
Yep.
told me to begin
it's
with.
fine. Yep.
But I've already
I'll
linked
take-
out, so.
I'll take it, just power down, I'll take your spot, they're not rocking and rolling yet.
You're just scratching my story.
It won't start with yours.
My
Thank you,
daughter
man.
has
All right. You want to plug in first, or
lung
use your
disease from
camera?
premature birth. So I don't, you know,
I don't
it's
give a
not
shit.
like.
You didn't have a
Yeah.
backpack?
Obviously, no.
I just haven't.
Well, I didn't know
Wouldn't have
if,
sent you.
well, I didn't know if yours broke or.
My
No,
brother's got Crohn's.
no, I got a
and,
lot
like,
of trucks, so I don't do.
other issues.
Oh,
I should probably pick that up, right?
Not yet, no.
no, we're dead now, so.
I'm just, I gotta calm
You
down.
frustrated, Jim?
Why are we staffing too many stories when we have other people who are available?
Oh.
It is what it is.
Fred?
He's going, he's leaving, I'm sorry, man.
Oh, that's what's
He's
happening?
leaving altogether, yeah. Yeah.
Hey, honey. Hey, how are you?
Oh,
And they didn't want to bust.
I know, if I were.
Sorry.
Hey, honey, how are you? Oh, you know, same as you. Yeah. Yeah. Classic. So, I'm gonna do time day.
Mm-hmm.
We're still pretty on, right?
Same as last time. I don't think it would have changed.
Right? Did you hear that, Chris?
What do you say?
See you kids later.
See you, kid. Thank you, man. I
You're
appreciate
welcome.
What's up with you guys? You're sending 2 photographers every shoot. I go,
All right? Bye, Jimmy.
Seriously, I
We'll get together when this is all over.
absolutely. I'll meet you at poker. You'll have to go to the 18.
Well, no, I want to play with
I'm
your
teasing
daughter.
you.
I want to meet her.
I know.
So long we get better.
That sounds good.
Okay. Yeah.
I've had this cough for, a month and a half. It's fine. It's fine.
That's how long these symptoms last.
No, I like I was really sick. This is nothing. Probably.
What's going on, man?
How much are you doing?
Awesome.
Haven't seen you in a while.
Yeah, well, I just had coronavirus, so I just came back to work like 10 minutes ago.
Yep.
Hey Alex, this is Sherbin. I took over for Keith. Just want to make sure the signal's still good and you have sound and all that kind of stuff. Just double check.
Where you sitting? Stand.
Okay, I'm gonna wave and you see my hand? Alright, cool man, thank you. Alright. well, maybe not everybody. Do you want to hear, if you want any questions on, just put the mic on, okay?
Thank you. Hi, I'm Susan.
No, I think he's in.
He just stepped out. He did, like 5 seconds ago. All right, great. This is good news. I'll stay here first. Oh, great, thanks.
Just in case you're worried.
Okay, thanks.
She said it's smart to send somebody a night sight person. versus
Yeah,
a day
I
sight
see what
person.
you're talking about. I'm just,
No, I was.
Yeah.
Well, just don't turn yours on.
We
Good
didn't
enough.
go into the Detroit police press conferences, we just were like, well, it's another 10 people, we can do it on FaceTime. But I don't think that's an option for this one.
I like when we were all crammed in the I'm like, the speakers couldn't climb over us to get to the podium. It's just like, what are we doing, people?
Guys, it's gonna be a long couple months.
It is. I think it's gonna be longer than probably.
Yeah, no, we will, because we'll probably.
We're gonna need like,
officially.
we're gonna need like counseling after this.
Yeah, we all need
Hey, Turkey,
What's up?
nice to see you.
Over here? Oh, it's all over the place here.
Well,
Dude.
it's safety protocol, man.
Funny how the safety protocol goes out the window when you're in a live truck with somebody all day.
Yep.
Oh, I know. There's like these cars though that we'll never be able to get in for some reason. We all have cars that are just sitting in the lot. It's like they're trying to outthink it, you know?
I have cleaning supplies in my personal car, including a can of Lysol and like disinfecting cleaner that anytime I step into it, I'm like.
But then again, trucks through Benham or something so nice.
They clean yours, they clean them. Ours are like luxuriously clean.
No, ours aren't, but
And they smell good, like it's very.
Ours don't
strange.
smell good, but see, we need to take ours where they are.
They bought me this 10-foot pole.
Oh yeah, we got those coming.
Oh, it's gonna be a lot of fun.
Hey, what's up? Yeah. No, I don't, but I will right now. Backpack has it, so I'll pop it in and, you know, I'm aware though, I knew that they were gonna take it live, so. But let me turn IFB on right now and, yeah, and then hold on. Yeah, I'm gonna use the back, yeah, I'm not near the truck, so I'm gonna use the backpack, just, hold on, I'm gonna put you down, and then I'll pick back up, we'll check it, all right? All right, hold on.
Hey man. Yeah, LE5, yeah. What? What do you mean? Oh, there was one, yeah.
30 seconds here, so if you wanna get ready.
Oh,
All right, Alex. I got it on, but I don't hear anything. No. No. Yeah, all right. I didn't think anyone was gonna talk to me. I was just gonna operate under the assumption that I'm live, which I will be, so. All right, man, thanks, Alex, appreciate it.
We're going to start with Susan Grant, and then we'll have Dr. Nick Gilpin, our Director of Infection Control for the system. They're going to give some brief comments, and then we'll open it up for questions.
And when they get up there, would you mind having them say and call their name, giving us the first name?
I'm going to do it. So it's Susan, Susan, S-U-S-A-N-G-R-A-N-T. She's our Chief Nursing Officer. And then Nick Gilpin, N-I-C-K-G-I-L-P-I-N. And he is our Medical Director of Infection Prevention and Epidemiology at Beaumont. So you got that? Susan Constone, Grant, G-R-A-N-T. Okay?
Thanks.
Good afternoon, everybody. A Beaumont Health patient, a male in his 50s, who tested positive for the COVID-19 and had other underlying medical conditions, passed away early this morning at a Beaumont hospital in Wayne County. Our medical team went to extraordinary efforts to care for this patient, and we are deeply saddened by his passing and empathize with his family. I want to thank our physicians, nurses, and medical staff who are all working together to care for COVID-19 patients. During this time, we are all united to battle this virus, and we must continue to serve and care for the non-COVID-19 needs of all patients, whether they are giving birth, needing essential surgeries, or requiring life-saving emergency procedures. As a health system, we have taken many steps to prepare for COVID-19, and we are expanding our efforts every single day. While we are all saddened by the first death of a Beaumont patient who tested positive for COVID-19, it is also critically important for the public to understand that all efforts underway to stop the spread of this virus and treat people who are ill. I'd like to now turn it over to Dr. Nick Gilpin, Beaumont Health's Medical Director of Infection Prevention and Epidemiology.
This is an unprecedented situation in Michigan and across the country that we're dealing with right now. I'm incredibly proud of our team at Beaumont, and I'm incredibly proud of all my brothers and sisters in healthcare across the country who are battling this situation. I want to talk about Beaumont's response. Beaumont has built a large-scale COVID-19 screening and testing operation. We really need your help in the media to get this message out to the public because we think it's important and it's time to have this conversation. Coronavirus testing is being processed on-site at Beaumont on a limited basis. We simply do not have the bandwidth, the testing supplies to test everyone. On Tuesday, March 17th, Beaumont processed approximately 500 tests. We've also sent more than 1,000 other tests to state and other national labs for testing. Testing facilities are being overrun. I want to be clear that not everyone with COVID-19 symptoms, which includes fever, cough, and shortness of breath, needs to be tested. What I'm calling this is the pivot. COVID-19 is in our community. It's with us. It's not just something that lives overseas anymore, it's in our backyard. And so a lot of patients who are experiencing relatively mild symptoms, who don't have underlying medical conditions, who are young and otherwise healthy, frankly, do not need to be tested because it will not change the way that we manage you from a healthcare perspective. Beaumont does recommend talking with physicians or nurses on the phone prior to seeking testing if you do think that testing is necessary. We've also set up curbside screening at all of our Beaumont facilities to help facilitate this. On March 17th, Beaumont staff screened about 1,500 patients at our curbside facilities. We also have a coronavirus hotline. That number is 800-592-4784. It's staffed by Beaumont nurses and staff members. The purpose of this hotline is to help triage people appropriately to the right level of care. If you call the hotline and you don't have moderate or severe symptoms, there's a very good chance that you will not be directed to testing. But if you do have medical conditions that put you at higher risk, or advanced age, or if you have moderate or severe symptoms, you may be directed for further evaluation. Beaumont has also put in place visitor restrictions at all of our campuses. We're also canceling non-essential surgeries and other non-essential services such as physical therapy, occupational therapy, speech and language therapy, cardiac rehab, pulmonary rehab, and other non-essential services have been put on pause. The main Beaumont Command Center is helping the entire Beaumont team coordinate and share resources. We're also working closely with state and federal health agencies and lawmakers. We're having those conversations on an almost daily basis. Our mission right now is to protect our patients and the public, but our mission is also to protect our staff. We are providing our staff with adequate PPE, that's personal protective equipment, and we're educating them on how to properly use it. We're also following all appropriate infection control procedures, and we're collaborating with other healthcare systems to make sure that we're all providing the same information to our employees and our patients. I'd like to turn it back over to Susan now. Thank you.
Thank you, Dr. Gilpin. I'd also like to let you know that we also plan to launch an online risk assessment tool this afternoon, later today, which will also help us serve our patients during this pandemic. That this online risk assessment tool will assist people who, as Dr. Gilpin has said, do not need to be tested and do not have underlying medical conditions, to be able to go on this online to do this risk assessment and to determine what the best steps are for them to take at this time. Again, I want to thank our Beaumont physicians, nurses, and all of our employees for their amazing work in fighting this virus. And I'd like to join Dr. Gilpin in thanking our brothers and sisters in healthcare around the country in joining this fight as well. So now we can take some questions, but please note that we are limited in what we can say due to patient privacy laws.
Ms. Grant, can you tell me where this patient may have gone? This will probably be one of the first questions the public would like to know.
Sure.
Yes.
We can't talk specifically about which hospital the patient was cared at. It was one of our Beaumont facilities.
I just didn't get into the underlying conditions. Is there anything else you can tell us about this person?
We're still working on getting that information ourselves. We can't really talk about specifics regarding the patient's condition.
Do you have any sense yet of whether it was a travel-related case, community spread case?
There's no information at this time that it was travel-related or community-related.
Are you able to tell us how long he was hospitalized?
Don't have that information either.
Nick, so here's the question. If I'm 40 years old and I have no underlying health concerns, but I start to feel the fever, the and the whole thing, you're telling me that the best course of action right now would be to self-quarantine, call my office and say, look, I've got these symptoms, I'm young, I'm healthy, I don't need to clog up the testing portal. Is that basically what you guys are saying right now to the public?
I could not say it better. I think that is exactly the message that I want to get out to the public. Mild symptoms, young, relatively healthy people without chronic medical conditions, we don't have the capacity to test all of you. There's a very good chance that many of you may have COVID-19, frankly. And testing you is not going to necessarily make a difference with regard to how we treat you. We're going to recommend that you go home. We're going to recommend that you practice social distancing, self-isolation, hand hygiene, respiratory etiquette. washing all your high traffic surfaces at home, all the usual stuff that we would recommend to anyone right now. That's exactly the recommendations that we're giving to our patients who are coming through our curbside testing also.
Can I ask about underlying conditions? You know, there are underlying conditions and then there are underlying conditions. If I have, I mean, when does the underlying condition become the issue? I mean, there's a huge difference between having rheumatoid arthritis and having cancer. You know what I mean? Like, what, are there some specific underlying conditions that would be more concerning than others? Something that you guys are zeroing in on when somebody calls the hotline?
Sure. So I think with regard to underlying conditions, first of all, our hotline and our online risk assessment tool is just that. It's a risk assessment tool, right? You can't really screen and diagnose someone effectively over the telephone, but we can risk assess. So when you call our hotline, you're going to be asked a number of questions about your age, about specific medical conditions you have, and the conditions that we're focusing on are the chronic medical conditions like heart disease, lung disease, conditions that compromise your immune system in some way. Those are the things that are going to push you into a riskier bracket with regard to maybe you do need to be seen more urgently than someone that doesn't have those conditions.
And when you're talking about the conditions that compromise your immune system, just for folks who don't know.
Conditions that compromise your immune system, so there's lots of conditions. Specifically, they could be medications that you're taking that compromise your immune system, like certain steroid preparations or medications that people take for inflammatory conditions. Autoimmune conditions are often considered immune compromising. Obviously, we have our HIV population and people with chronic infections that we're concerned about as well. Those are considered immune compromising.
So can you tell us about the patient who passed away? When did the gentleman come into the hospital, and what kinds of symptoms did he come into the hospital with?
I'm sorry, I don't have all that information.
Nick, we're already starting to see smaller hospital systems get several ICU patients who are either suspected COVID cases or confirmed COVID cases. Can you guys speak at all to where Beaumont Health Systems is on that? Is it something where it's like a few people are in ICU, it's becoming a larger population? Can you speak to it even generally?
I can generally speak to it. We've tested a lot. We've had dozens of cases within our Beaumont hospitals, all 8 different hospitals. As of right now, we feel adequately staffed and adequately resourced. We're constantly having these conversations with our sister organizations throughout the state and with state lawmakers to make sure that should the need arise, we can have access to things like ventilators and other medical equipment that might be necessary. But I'm happy to say, as of right now, we feel well stocked.
I ask that because I think people are going to want a better sense of if this guy was in the ICU, they want to have an understanding of, are there a lot of people in the ICU with similar conditions, or are most of them, I know not all of them even have to be hospitalized, are most of them in general care? Are you starting to have more in the ICU? Can you give us any kind of sense?
We're ramping up our capabilities to take care of patients in an ICU capacity. I think you need to look no further than what's happened in other countries where this virus has ravaged, frankly. Places like China, South Korea, and Italy really challenged their critical care capacity and their bed capacity. So we are absolutely thinking ahead. The key to infection prevention and epidemiology is trying to stay one step ahead. And that's what we're trying to do on an everyday basis here at the Command Center.
How do you think this is going to increase in terms of the rates of patients that you're seeing? And what challenges do you face in meeting that? And is there anything the public can do that can help in you meeting that?
Well, for starters, I think you're going to see the number of cases escalate tremendously. And that's partly because you're going to see more real cases, and it's also because our testing is going to begin to catch up. Now you're starting, in the beginning, the state and federal health authorities were really the ones doing all the testing. Now you've seen that testing capability go out to private labs. Now you're starting to see healthcare systems adopt their own testing. So with more and more people testing, you're going to have more and more positives, which mean more and more confirmed cases. But you're also going to see a lot of those patients start to present themselves to healthcare because the virus is also spreading through the community. And I'm sorry, what was the other part of your question?
Is there anything the public, with it increasing, are there concerns about capacity, and at what point are there estimates, projections that you guys are making? And is there anything the public can do to help mitigate what you're expecting to happen?
Right. I think what I want the public to know is if you're not sick, if you're asymptomatic, if you think you've been exposed, call us. don't come showing up to our emergency department, okay? We need to preserve our precious resources. And right now, our precious resources as healthcare providers are our testing capabilities, our personal protective equipment, our beds, and our staff. Those are the things that are more precious than gold to us right now. And having people come in that frankly are not that sick consumes those resources, and it really hinders our ability to provide care to the ones that need it the most.
How are your people holding up?
It's stressful. I'm not gonna lie, it's stressful. And I worry about my staff all the time, but you know what? I've also seen the response here just like I've never seen anything before. I feel like people are banding together. We know we gotta get through this. You know, it's mission critical.
What kind of capacity increase are you seeing in order to handle the expected influx of patients?
Can we talk about that? Capacity increase?
As Dr. Gilpin said, we've been planning every single day to anticipate a surge of patients, and so we have been reallocating resources so that we can be prepared for when that happens.
What do you say to folks, I mean, when you hear about the first death, you know, in our state, it's scary. What's the message that you want to get out to people?
You know, I want to again say that, you know, my sympathies are with the family of that patient. It's a very sad day, obviously, and it's never any good to have a patient die. But I think that we also have to prepare ourselves that there will be more. Just simply being realistic, I think that we're really just kind of seeing the tip of the iceberg here, and we know statistically from other countries and other states that have experienced this on a larger scale than we have so far, that there will be a significant number of critically ill patients. There will be a significant number of patients that will die from COVID-19. But I also want to make sure that we're emphasizing that the vast majority of people who get COVID-19 will recover, and they will recover uneventfully. And that we're talking about a number that's probably close to 80, 85, 90% of people who get infected will recover uneventfully. And I think that's the message I want to hammer. Is sure, for a lot of you out there, you do need medical care, and we want to be able to provide it to you. But for the majority of you, you'll be okay.
I want to add to that in terms of capacity, while we're making room and anticipating needs and making sure that we are able to manage any needs that the COVID-19 patients may have, we are continuing to care for and ensure people in our community that we are continuing to care for and meeting their needs. We still have people who have heart attacks, strokes, babies, and we are here for them.
In terms of ventilators, we've heard about other countries running out of the ventilators needed. What is the situation here, and is there a call for the federal government to expedite any process? Is that something you guys are dealing with?
Yes, we are working with state and federal officials to ensure that we have the equipment and supplies we need. It is a challenge right now, but we are continuing on that every day.
How many
Can
more
you
would you like?
go back over the figures again once more, if you don't mind? You did 500 tests on Tuesday?
It's all in
What is the current capacity, 12 beds across all eight Beaumont hospitals, and what are you running percentage-wise right now?
We have over 3,000 beds. The percentage capacity is constantly changing. We can get that to you.
What can you tell us about exposure to staff in the community from this particular patient? Are there concerns there?
I'm sorry, can you repeat
The
question?
particular patient today, are there concerns for exposure to your staff? And is it known their contacts in the community? Are they being reached out to, family, friends?
We're being very diligent to make sure that our staff have what they need to appropriately and safely care for these patients. And, addressing that as we go along and ensuring that they have what they need.
I want to add that we have a very rigorous employee health system process for making sure that we always vet any exposure to our staff, because again, our staff is one of our precious resources, and we always want to make sure we're keeping our staff safe.
Can you speak to that a little bit? Different hospitals and health centers have evolving policies about who gets a surgical mask versus an N95. Do you do temperature screenings of staff coming in? Can you talk about where policies are right now in that area?
Well, just, respect the fact that this is a moving target. I think that's the biggest message here is that, what we're telling our employees and our staff today about PPE use and what our restrictions may or may not be might be completely different tomorrow. I think the big message right now is when employees are exposed to a patient with COVID-19, as long as they're wearing their PPE appropriately, there are no need for any concerns or work restrictions. It's really in those situations where someone, it was an unknown, or maybe someone wasn't wearing their PPE appropriately, that employee health needs to get involved, and we have a process for evaluating that.
Would you consider a surgical mask or an N95? Which one of those when you say PPE, what are you saying is sufficient for protection here?
I mean, I could get in the weeds on, the
Get
details,
in the weeds,
but
like surgical mask or?
Well, so what we're recommending right now is for patients who have confirmed COVID, we prefer an N95 mask. But we're also willing to flex if supplies don't allow for us to use N95s. We feel that a surgical mask is a reasonable alternative. We know that COVID-19 is a pathogen that's spread mostly by droplets, and we know that using surgical masks in those situations provides an adequate amount of protection for most of our staff.
Just take a couple more questions and then they gotta go.
There's a shortage of masks and gloves all around.
Yes.
Would a clean towel or handkerchief, rag around your mouth and nose, would that suffice for protection?
I would say not.
Okay.
And I know the man is in his 50s. Do we know the exact age?
We're not really seeing that.
I'm sorry,
Does it matter if there's so much information you can't give us about this individual? Do you think that matters?
I think we're still learning ourselves, frankly.
This testing data that's coming from the state is having a hard time getting a full picture because private labs aren't required to report how many they've tested, how many were negative. Do you think there needs to be some kind of uniformity to this system fast?
Yeah, I think we do. I think we need to start, testing is important. We want to be able to offer testing. We want to be able to offer testing to our patients. I think in a perfect world, I would love to be able to test everyone that wants a test. Reality is, I can't. I simply can't. And I don't think any healthcare system will tell you that they can right now. And so absolutely, I think it's a break the glass moment for testing, that we need to be having these conversations, and we have been having these conversations with our other healthcare partners, with the Michigan Hospital Association, with lawmakers, with the state and federal health authorities, to really try to free up the capacity to do more testing. Absolutely.
All right, last question.
In the 8 Beaumont hospitals, how many inpatients do you have that have been diagnosed with COVID-19?
I'm comfortable telling you we have dozens. I can't give you a specific number because unfortunately that number seems to move almost hourly.
Thanks, everybody.
Thank you. And thanks everybody for practicing social distancing.
Yes.
Appreciate that.
Go ahead. It's all right.
Susan Grant is Chief Nursing Officer.
Dr. Gill.
I don't see it in here.
Yeah.
A little higher.
Okay, so Chief of